Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
That's a great question, and a difficult one as well. I think the patient's voice is extremely important and should be much more appreciated in the decision-making of healthcare. In my opinion, patients are probably the most disruptive force in the healthcare space, and they should be listened to. Apple and other consumer companies, they listen much more to the end users, and I think patients should have a stronger voice, and we will do everything to support the voice of patients, because at the end it matters what ends up in the patient's hands. Wow, that's an important question. My personal interactions, I should better say our interactions, because this is a true team effort that has both reconfirmed the importance of involving people living with the disease early, really early, as well as provided additional relevant insights that we would have never gotten from literature, healthcare professionals, and other sources. Hearing it from people who have direct personal knowledge of kidney diseases 24/7 and 365 days per year is invaluable. The research will get much better using patient insights, because these people know what they're talking about, and you get additional insights you would never get. I can highly recommend involving patients and patient representatives as early as possible in R&D projects. The earlier the better is a good guiding principle. Furthermore, the continuity of the engagement is very, very important. We don't do one-off activities anymore, but we try to establish a long-term commitment so that we can build a real partnership. The best practices also need to be tailored to the needs of the community, and I think listening is more important than talking. Thanks to AAKP for doing that research, and thanks again for allowing me to answer these questions. I think patients in the driver's seat, that's exactly the right guiding principle. And the excellent question is not an easy one to answer because it may be different for different patients and different patient groups. Simply because I really believe in personalized treatment and tailored solutions. Now, concretely, I think patients should try and get as much information as they possibly can from their community. And that's a task for the pharma companies to appropriately inform the patient organizations about clinical trials, for example, and new diagnostic opportunities. So it's a two-way street. In their networks, patients have a unique opportunity to share the information in appropriate channels and a safe space. I understand and appreciate that a closed Facebook group from a patient community is probably a much more credible source of information for people living with the condition than, for example, company websites. So keep up the spirit, AAKP, and the patient's voice is extremely important.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.